Welcome to the Infosys Healthcare and Life Sciences Perspectives, the podcast and video interview series with thought leaders.
Hi, my name is Venki Anand. I head the Infosys Healthcare business globally, and this is a edition of our podcast series around healthcare, and I'm very excited to have Saurabh Gupta with me here. Saurabh is the Chief Strategy Officer for HFS. Saurabh, can you tell us about what HFS is all about?
Sure. Thanks for having me here, Venki. HFS is a global analyst firm. We look at the emerging technologies from robotic automation to artificial intelligence, smart analytics, blockchain, IoT. But the focus for us is what's the impact of these technologies on businesses, on different industries,
Right.
healthcare being one of the primary focus for us, because I think there is I call it there's a East versus West divide that's happening. The West Coast keeps coming up with new technologies almost every day,
Right.
and the East Coast is still struggling to adopt those. And I think we sit in the middle,
Right.
trying to help both on what's the application of these technologies, what are the challenges, and how do you actually
Sure.
make use of them.
Great. So, Saurabh, everybody's talking about consumerization of healthcare. Everybody's talking about putting patient at the center of the healthcare universe. What does this really mean? Is this really happening? What are your perspectives, Saurabh?
Yeah, I think so. To be honest, I think patient should have always been the center of healthcare. It shouldn't be now or in the future. It should have been always. And I actually don't like patient being in the center. It has to be consumer, right? Because not everybody's a patient.
Sure.
I think it derogates the healthy people. But I think thus far, what has been happening in terms of the patient centricity is the industry has been giving it very sort of a lip service to it, right? We've just been talking about a sexy UI, but does a sexy user interface means real good customer experience? It does not.
Right.
And that's why we've been talking about the one office. And that essentially means that we should move away from this siloed vision of there's a front office, there's a middle office, and there's a back office. But there should be just one office, and that's the office that caters to the customer. I think what's happening now is that there are a lot of these emerging technologies that are making that vision of the one office more of a reality. So I think that, to me, is what patient centricity really means,
Sure.
is to sort of break the silos that we have, be it a payer or a provider or even a life sciences firm, from this siloed thinking of this is the front office, and the front office is the only one who connects to the patient or the consumer.
Right.
But I think if you look at things like revenue cycle management, right?
Sure.
It doesn't billing impact the patient. It does.
Yeah.
And that, to me, is what patient
Sure.
centricity really means.
Basically, rally the entire organization around the consumer and ensure that they deliver to what the consumer cares about. Right?
Exactly.
Right.
Exactly. I think we've had a lot of discussions with CIOs, CFOs, and everybody in both payers and providers. And I think while there are differences of opinions on what my performance metric is versus what your performance metric is, nobody would say no to ultimately what I need to do is care for my consumers.
Sure.
So I think it really helps to rally the whole organization around that one office concept.
Sure.
And I think if you can do that, then you're halfway there.
Perfect. So that's a great segue into my next question that comes to my mind, Saurabh, which is the emergence of retail clinics. Right. Now there is with CVS acquisition of Aetna, or for that matter, even Walmart. There seems to be a great shift from having a front door for healthcare, which is your retail stores becoming the place where patients or members or consumers, what have you, can walk in and actually interact with somebody and consume healthcare in its full shape and form.
Right.
What's your opinion about this? And is this a trend that is going to be the way forward, or is this something that CVS is doing it because they acquired Aetna and they have all these stores?
Yeah, look, I think following up from my one office conversation that we were just having, Venki, is if we believe that patient centricity is the end all be all for the healthcare industry, which I think we do.
Sure.
Then I think even the one office is not enough, right? Because let's say you are a payer or a provider or whoever, right? You don't own the consumer. Right?
Sure.
The consumer has to deal with so many different stakeholders, and here in the US, it's super complicated. You have to deal with the payer, you have to deal with the provider, you have
it's a highly fragmented delivery.
It's a very highly fragmented delivery. So even if one entity creates that one office, that doesn't determine the patient experience.
Sure.
And that's why we believe in this hyper-connected future state, wherein an ecosystem needs to evolve. Right, where the patient needs to have somewhat of a seamless experience between the payer and the provider and the life sciences and the government or whoever is involved. And I think it's very hard, right? Because in this industry, in the healthcare industry, we don't like each other too much, right? The payers don't like the providers, nobody likes the life sciences, the government is doing its own thing. So it's very hard to create that ecosystem. And that's why we've seen some of like the CVS Aetna acquisition that you mentioned. I think it's much easier to acquire and do it on your own than build the ecosystem. But I think the genesis of that is, again, patient centricity in my mind. And at some point of time, we'll have to create these ecosystems to come together.
Right.
Because my worry with some of these is, do we start to create monopolies? As well. So I think the intent is right, and I think that's where we need to go. But I'm not sure if there has to be just one single payvider of sorts which sort of does everything. I think that's somewhat scary also.
So then where is the provider in the mix? What is your sense about, is the provider catching up? Because most of them tend to be in general, they are a little behind in the adoption curve. Obviously, providers are more focused on the clinical experience and clinical delivery of care. So, what is their adoption speed, if you will, of technology, about these new industry trends in terms of having an integrated one office, as you call it, to give a very unified experience to the consumer? Where are they in that adoption curve? What is your perspective on that, Saurabh?
Yeah, no, I think that's a great question. And I think the provider community always lags.
Right.
I think the healthcare industry generally lags the technology adoption. And then within the healthcare industry, the providers lag. And just not because they don't understand the importance of it. It's just that most providers are smaller in size. And it's hard. Once you're small to make those kind of large investments and big bets. So it's just the nature of the beast. But having said that, I think some of the emerging technologies that are coming in are very affordable now, or are becoming increasingly affordable. So, for example, take cloud. For example, now all providers are struggling with the explosion of data. Right? You have to store your X-rays and mammograms and what have you for 20 years, I think, in US, and in some countries it's even more than 20 years.
Exactly.
And you cannot do that on your hard disks or even your private cloud. But I think as you see public cloud coming in, and most of the public cloud is now HIPAA compliant, etc. That sort of lowers the entry barriers in my mind. I think if you look at some of the other technology trends like containerization, for example, that again, in my mind, sort of lowers the entry barriers because you can create something in a container where it can be scaled up, scaled down, moved from here to there, etc., which is really what agile should be. If you look at things like artificial intelligence, now there are algorithms that are actually available. There's a lot of low-code, no-code applications that are coming in. Which can help people. You don't need to be a data scientist to use AI anymore, and so on and so forth. If you look at the emergence of open source, for example, if you look at blockchain and others, a lot of the code is open sourced. Even companies like IBM now are investing in big time in open source. Right. So I think there are a lot of positive technology trends that I think, despite the size disadvantage that providers have, they can actually jumpstart.
Right. So your point is that adoption should no longer be a challenge. From an affordability perspective, it's definitely coming down.
Yeah.
From a need perspective, there is more and more need because there's an explosion of data.
Yes.
So you simply cannot afford to ignore it.
Yeah.
And the third dimension is that technology is now much more open source, so that in terms of adoption of some of this technology, it should be pretty straightforward.
Yeah, I think there are no real barriers. I think the biggest barrier is the mindset. And I've often jokingly called it the 1991 adoption challenge. Wherein if you look at any emerging technology, there's only 1% who's really adopting it. The other 9% are hoping that the 1% will do something and then we'll follow. And then the rest of the 90% are blissfully ignorant. And they're saying, who cares? We'll continue to do what we are doing. We are in good shape. And that's the mindset shift that I think is a bigger challenge than anything else. And how do you change that mindset? It's, I don't have a silver.
Which brings me to the next question, which really is, while that was the paradigm in the past, I think more and more consumers / patients are demanding this even from the providers, right? So there's just no choice to no longer say I don't care, because especially with the emergence of millennials becoming mainstream, I think more and more people are also conversant with a lot of these technologies that have become mainstream in our daily lives.
No, I think that's a fair observation. I think the why is pretty clear. I think the patients are demanding it, the government is demanding it. If the whole move towards value-based care is a good example of that. You can't really, even if you don't care about your patients, I'm just saying that jokingly, then you've got to do it from a compliance standpoint, right? So
and then CMS pushing interoperability,
exactly. So the why is there. I think people do struggle with the how. How do you get there? We know the vision of the promised land. We know it's got to be something about these emerging technologies. But how do you get to that promised land is the struggle, and that's where the mindset shift is what I'm talking about. Needs to come in.
Thank you so much, Saurabh. Appreciate the insight as always.
Hey, no, thank you for having me.
Thank you.